Ohio is one of the more active states when it comes to gambling, and we're joined by Shona and Nabil of Recovery Resources to take us a little more in-depth into this topic. Shona, you're the CEO. How long has this organization been around and how has it evolved?
Thank you. Our organization has been proudly serving the community for almost 70 years. We started in 1955 as the Cleveland Center for Alcoholism, and we're really focusing on supporting individuals in our community who are experiencing alcoholism. Over the course of time, as the needs of our community has evolved, the mission of the organization has expanded through local and national partnerships to provide services to those experiencing mental illness, substance use disorder, and other addictions such as gambling disorders. So our most recent partnership expansion was with the Metro Health System, and through our affiliation with the Metro Health System, we're able to provide not only mental health and addiction services, but also make sure that individuals are being connected to primary care and physical health services that they might need along their journey.
Okay, Nabil, can you tell us some of the warning signs if we've got a loved one who is starting to develop a gambling addiction?
Yeah, so some of the more common warning signs when it comes to disordered gambling are if somebody is lying about how much they're gambling, they're maybe hiding bills, from loved ones. They're more irritated, more agitated around their gambling. So those are some of the little warning signs that we might see.
What's the difference between problem gambling and disordered gambling?
Great question. So really the big difference is problem gambling really comes before disordered gambling. Problem gambling is where somebody is gambling more frequently, but they believe in certain fallacies, superstitions, right? You can think of a little troll doll that somebody might have with them, or knocking on the side of the slot machine, things like that, where they think they're going to win their money back, or even just winning money in general. And disordered gambling, that's where we kind of step more into having a conversation with a clinical professional, talking about some of those warning signs that we just mentioned, really working through that.
How about Cuyahoga County? How many people suffer from a gambling addiction based on your data? So
a little more than 2% of Cuyahoga County residents are at risk for problem and disordered gambling. To kind of paint everyone a visual of that, we always like to use the example of, imagine the Brown Stadium, and imagine that stadium is filled to capacity, and we sprinkle 5,000-10,000 people around the outside of the building. It used to be, that's how many people were at risk in Ohio. Now, after this 2022 data was released, now we're looking at that number being related to Cuyahoga County residents.
You provide so many resources. How can people access those, Shona?
Thank you for asking. So Recovery Resources provides care and services along a continuum, because that really is what someone's need is when they're on their journey towards wellness and recovery. Our continuum actually starts before someone is experiencing mental illness and addiction, and through both our education and community engagement programs. So Nabil leads our prevention team as well, and through the partnership with the Cuyahoga County Adams Board, we're able to go into the schools and provide prevention education to students K through 12. We operate an employee assistance and training institute where we partner with employers in our community who are addressing different needs of their staff from a wellness and an addiction perspective. As we move along, we have partnerships with the City of Shaker Heights as an example, and surrounding communities to provide a mental health response program. So really being able to support someone hopefully before they're experiencing more acute distress and need for additional resources. As someone moves along, though, we know that are times when they need treatment, and so we provide a full array of treatment services to support individuals in addressing both their mental illness and addiction, and oftentimes those are going together, so individuals may be experiencing both. We have clinical treatment, so think of individual, group counseling, intensive outpatient programming. We have a psychiatric services team that also provides medication-assisted treatment services, so we're able to really support someone holistically when they're moving along their journey towards recovery. And then all of the supports that they might need along the way, so case management, peer supporters to really help them in between visits. I mentioned earlier that we have an affiliation with the Metro Health System, so all along their time with us, we're also helping to make sure that they're connecting to primary care services to address any physical health needs that they might experience. And as someone moves along farther in their journey, we have a housing program, an employment and vocational rehabilitation program as well. So as individuals are ready to re-engage in the workforce and housing, then we're able to support them in their journey as well as they're moving along. So lots of ways to access the organization and receive services based on where someone's at in their journey. It's a very individualized process. We do accept insurances. It's an affordable set of services. We work with everyone to meet them where they're at, both from an insurance perspective and other funding opportunities where that's available as well.
Such incredible work and all-encompassing options. I know I have a sister who is 7 years in recovery, and she could not be where she is now without helpful services like the ones that you provide. So thank you so much for all of the helpful information, and thank you for joining us today.